Basically, the general problem that we have in a specific set like medicine is like the AI tools are not really prepared to help you in the way that you really need to be helped. But it's not relevant for me if cannot get me the right information that I need because AI lacks of context. And that's exactly if we are talking just about clinical or AI on medicine, the study is clear.
Hello, everyone, and welcome to the Paratus Podcast, the Emergency Response Podcast. I'm very excited to have a guest today to talk clinical and medical AI. My guest is Dr. Javier Rosas. Javier is a senior ship physician with more than a decade of frontline emergency and maritime medicine experience, caring for patients at sea, where decisions often need to be made quickly, with limited resources and far from definitive care. He's now focused on bringing that real-world clinical perspective into medical AI. Javier works on prompt engineering, rubric development, and evaluation frameworks for medical reasoning systems. He's contributed to medical LLM evaluation and serves as a peer reviewer for clinical simulation tools. He also writes and teaches about AI in healthcare, including as the author of AI Literacy for Clinicians. Javier, thank you so much for taking the time to come on the podcast.
Hey, Francois, thank you so much for having me. It's been a real pleasure to engage with you and see how more and more clinicians and doctors around the world are really getting interested in how we can apply all this boom of the AI, which is coming upon us every day. Every time you open X or Instagram or any other social platform, you are already getting bombarded with a lot of information regarding AI. So I truly think that we need to do something with that. We need to organize the information, and I'm been very interested since my young years in technology, informatics. Obviously, I decided to go with my passion, which was medicine. I'm from Colombia. I practiced medicine there for more than 10 years, and then I found my way to the maritime healthcare. I've been working for a very big cruise line for the Caribbean all over the world in the past 4 years now. Now I'm the senior doctor. Currently, we are deployed near to Australia. So it's been very interesting. And thanks to the magic of the technology, we can be engaged on so different time zones.
Absolutely. No, that's amazing. And I love that you are interested in this, but I mostly love that you practice in maritime medicine and are interested in AI, because obviously this situation makes it very much different from working in a center where you have access to any clinician, any medication, any technological or diagnostic platform that you would want. So really excited to get into this conversation with you, Javier. And I'd love if you said you prepared a case to get us a little bit into the mood of your thoughts about AI. So the mic is yours.
Yeah. Basically, the general problem that we have in a specific set like medicine is like the AI tools are not really prepared to help you in the way that you really need to be helped. I mean, there is always tools that you can rely on. There are certain tools that they are developing. They are very big platforms out there, content platforms or more academic platforms that can help you guide how you can treat a patient or what decisions you should make based on academic resources. We have plenty of those, but I realized when I have a case more than a year ago, when I start doing my research and when I start studying and getting my credentials and started really professionally studying AI, it was a complicated case of patient with dementia that it really happened to me. And I was like, okay, short of options with treatment we have on board. Obviously, cruise ships are very well staffed for what we are because we are floating hotels. We are all over the world, and I mean the cruise lines do a very great effort, let's say, to have all the staff that we need to have here. But obviously, it never replaces a real hospital. So some of the options for treatment are really short sometimes, specifically because in medicine every patient is different. It's like a combination of factors each patient brings is unique. So I have this patient with dementia, mm, with a complicated UTI, 78-year-old male, and I have a short of options. So I just went there and I wanted to see what this tool, what ChatGPT can get me. What's the point of view? And when I realized the options that the tool is giving me is something that I don't have, because obviously these models are trained to respond obviously in the best way possible, in the broadest knowledge content, in a knowledge basis which is vast. They have all the information, documents. They are being trained in billions and billions of parameters. But at the end, it doesn't, I realize, and that's why this case is important for us to talk about, because there is when I realized I don't care if this model is easy accessible because I have it in my phone. I can do it at every time, but it's not relevant for me if cannot get me the right information that I need, because AI lacks of contexts. My thesis, all the models out there, it could be helpful, yes, but if they don't know, if they cannot adapt to your context, then pretty much means a little bit for you. It's not going to help you in a meaningful way, especially when you are trying to have a second opinion or maybe trying to help yourself to take a better decision. I'm not saying by any means that we let these clinical tools or these LLMs to take decisions over our patients, but it's more like an exercise to see exactly until what point at this moment in technology we are and which can we rely comfortable in these tools. Recently, there are a few studies that I've been researching. There is a few researches from Harvard Medicine faculty, and they found more than 75% of the clinicians they are using AI tools, they don't trust them. So obviously we have our own knowledge, our own criteria. So when we have this kind of cases, we want to have someone, we want to have something that can help us. But at the same time, the studies are very clear. The tools are out there, but the doctors still don't rely on it. And that's only from the point of view as a healthcare worker. I've been in the other side. I've been training models. I know how most of these models are being trained, especially when they are trying to replicate or trying to assess a very specific and complex situations. And I understand how the models work since the training, since the deployment, how the architectural layout is. So it's opened my mind and I started researching, I started studying, going deep on this. I just gather all the information and I'm trying to educate people on what in my personal journey I'm been learning that's been very useful for me. And that's why I wanted to put everything in a book, which is like a book which is basic. There is a lot of people. Yesterday only, I see at this very powerful image, the amount of people in the world that they don't have a clue what AI is. And I'm pretty sure there is millions of doctors out there practicing medicine that could really benefit of this, because this is a tool. We need to embrace it. I'm not saying by any means that we don't need to adopt AI. We just need to have the correct structure to do it.
So, Javier, you said people use AI, but they don't trust it. My feeling is a lot of people don't even understand the basic way that AI works and the fact that it's actually probabilistic and the answer that it's giving you, like, it's not like it's understanding what it's telling you. Can you tell us a little bit about just the basics of how that works and what's really important for specifically for clinical medicine in general? And after that, we'll get into obviously the more specific settings like maritime medicine, for example.
Yeah, for sure, Francois. So that's chapter 1 of my book. I specifically put an example, 2 a.m. in the morning, a doctor is typing, chest pain, patient with chest pain 45 minutes ago, whatever the case is. So when you are typing in any general tool, you give a brief query, for example, 45 male minutes of crushing chest pain, diaphoresis, that's it, or EKG. Well, you can add some things. You are rushing, you put something quick. Then you have a good page of, okay, this patient most probably is having an STEMI. This is the guideline says you can do this, and that, and you will have, you say, wow, this is magic. I mean, this model knows what I'm talking about. This model is also recommending what I already thinking, because yes, I know this is probably STEMI and I need to do this and that. And now the model give me all all of this. But what happened is this is more, it works more in the way I put it in my book, like when you have your predictive keyboard in your phone, when you really put a query in any model, it tokenizes. So what it really does is your question is not being, obviously is not being clinically understand in the model. It's just being tokenized, and the model, that's why the name is a large language model. What it does is just predict what is the next best word to go with your query. So obviously it understands more or less what you're talking about, and then they will start creating and composing a response that sounds very confident, because it's not going to say at any moment, you should try this or you should try that. No, it's going to give you this is the guideline. You should do this, monitor this, and you will end with a full document of recommendations. But at the end, it's not any clinical reasoning behind. It's just a prediction of words that the model learned how to predict based on any specific query. And you can do this in law, you can do this in any task, and you will have the result of that. The model is just tokenizing your query and trying to give you the best context that probabilistically he is being trained to give you.
And when you say predicting, what data is the model using to predict that answer?
Well, there is a lot of structured data that every model and every company feed the models with. Basically, is upon the that's the difference between the models, right? We always every day we hear that, and that's for your audience, that every day we hear OpenAI launched this mode. Now China now launches this new AI model. Now cloud it has this own model. So basically every week or every other day, we are having news of new model coming. So basically, what every model is doing differently is the training. Obviously, the reasoning and the tokenization process, but at the end is how they are gathering the information to fit the models. Obviously, they are models who are trained to be more specific in some areas, but the correct answer this is could be anything on the internet. Wikipedia, books, posts, Reddit. I mean, everything that's available in the internet is what is filled. Now, from the trainer point of view, that's why the labs has this very structured and very good process, hiring experts when they need to do a specific test. Obviously, they are not going to train any medical model without having a human in the loop, which is one of the modalities of the training, which is a human overseeing what the model is doing. So you interact with the model, you expect a response, and you basically evaluate how the model is doing against your knowledge, with your critical clinical knowledge in this case.
So if then, with this explanation, Javier, if people use it and maybe don't necessarily understand all that you've just explained, why do you feel they don't trust it? And what's your feeling around that kind of trust-mistrust relationship we're having really in the sense of clinical medicine with AI models?
Exactly. If we are talking just about clinical or AI on medicine, and the study is clear. Clinicians or doctors using the AI tools, they don't trust because we used to think that we are better, right? So the model says something and you say, no, but I have 10 years of experience and this is not medicine. We have something that the model can never have, which is experience. And our own experience, it shapes how we think. So that's the best thing because you have your own criteria. The model can give you this and this and this. It could be very academic. But at this point, the doctors are not confident because can have a lot of this is a technical concept, which is there is no any agreement between the output that we're having and what we're expecting, if that makes sense. So basically, I think at the end is because we don't have yet a tool which really can understand your situation, because in medicine, every case of medicine, every setup is different. Now, talking on my niche, on maritime medicine, is really different from other aspects or other environments to practice medicine, right? Is different from rural medicine, is different from the hospitalistic medicine. Every setup of medicine, every patient, every treatment that we do is different in its own way. And obviously, every environment brings their own challenges as well.
So let's bring it back to context, and I'd love if you could tie that up with the case that you told us about at the beginning. Is there a way to use the LLM with your current context without having every time, or maybe that is the answer, but without having every time to say, hey, here are the 40 medications that are available to me. Here, is my clinical setup. So how would you reconcile? Because most people, as you just said, Javier, are not working in a setting where everything is available to them. So how do you reconcile that context with the query you're asking, with the answer you're going to get to the LLM to really optimize that situation?
That's a really complicated one because it's very specific at what you are really practicing, and at the end is what you really want. What you want to the model. You want the model to have a second opinion. You want the model to run a checklist. Maybe I'm forgetting this. Maybe I should do this instead. Maybe I'm forgetting this parameter. Obviously, medicine is a vital thing, literally. So, doctors, we have been trained to take care of our patients, of course, and we are not giving up that responsibility to any piece of technology at this moment. And it will take years until we can just really be confident on that. So, that's the first thing. The second, a more practical way for any doctor that is watching this podcast and maybe they are getting interested in AI is to try to educate. We need to educate ourselves on how this model works so then we can adapt because that's the beauty about all these technologies is like you can adapt to your own reality. If I practice here with 40 medicines because that's what I have here, or maybe it could be 100 or 200 drugs that I have, I can model my own context so I can get more, let's say, reality grounded responses, but it's not easy, obviously, because these general models are not made for that. That's the main reason. They forget the context, they hallucinate, and that's a very, very important part that we need to understand. And this brings us to other topic. Um, we can talk about that. Is why we don't trust AI is because we usually catch that the AI is made of data. There is a recent post in X, I think it was like couple of months ago, when they were relying all the data for the statistics of the company to an AI model. And at the beginning, everything was completely peer review and they were running like one on one and everything was fine. So they relaxed. And then the model started making up the numbers. So when they realized a few weeks later, they realized that they already have two very different um, data sets because the model just started making up. So the algorithms that work with AI, they are very good to process structured data, but sometimes they try to take the best path for them. Let's say they think which is the best thing to do here. I predict this is going to be the best next word to be with this. And they start doing for that. And that happened in medicine. It happened to me a lot. Now I'm deeply working on training. This is not my own model, but basically, let's frame this that I'm personally working in a safe environment where you can practice medicine with all the power or any LLM, but you will have a lot of safety nets. So the responses that you are having is something like it's really grounded to your reality, grounded that the guideline says is grounded to your patient, which is really important. I have seen cases where I'm training my model, doing queries back and forward, and then I say, where I say that this patient has this locus in it happened to me 2 days ago. I never said this patient has a glucose levels or 200, 245. Where this data coming from? Because I was comparing some results and I never put that one. And the model, it says, oh, sorry, I just made that up, that number. Easy as that. So if you rely blindly on that, you will end up having this. And I've seen this multiple times. I have a lot of examples, not only medicine. In any query, you can ask, make a document about this, and at the you can clearly go one by one, you will always find that there is some sort of some levels of hallucinations. So this is some concepts that any person that is really going deep on trying to use AI as a real tool need to be aware because obviously you need to understand how to work around. These tools are not perfect. They are evolving faster than we can adapt, and that's a reality. This is blast is not only for us as individuals, for corporations, for big enterprises. They are trying to cope, but it's not easy because they are high stakes in place. So That's the reality. Again, the message for all your audience that wanted to get involved in AI is to try to to do the try to ground for model shape these tools at your reality and keep in mind what you really want. What's your point with this?
Yeah, and for people who might not necessarily want to train their own models like you're doing, Javier, is there something with the more available models? Is there a way to adapt prompting? Is there a way to add extra context? What would be ways, and once again, maybe going back to your case, is there a way where this kind of open model can help you in your situation just by adapting things that you can do?
Yeah, I mean, we go back to the same basic and fundamental problem, which is the better quality of the question is the better quality of the response that you will have at the end. So if you give more context to your queries, obviously you will have a more grounded solution. So instead of saying, I just have this and this patient, I will say, okay, I have this patient with dementia with a prolonged QTC, which is an abnormal parameter in the electrocardiogram. And some of these medications could be harmful for him. These are the medications I don't have. Maybe I can use this on that. Help me check which is the best available or what could be the next best step to or help me review what statistically is safe. So in that matter, we are shaping our queries in a more technical way. It requires more time. They are more thoughtful queries, but at the end, you will have more helpful answers as well.
That's very interesting. I love getting into the specifics maybe more because obviously you, as a clinician, you're supposed to have anyways context and understand a little bit where you're going. So asking a more specific question. Do you think these models will ever be titrated to all the different environments we work with? And obviously, I'm especially interested in emergencies or situations where stakes are higher or there's some time pressure there. Do you think there's a way that these models will, the larger models, or will we have to create our own that are more adapted to these situations?
Yeah, that's a really great question. Francois, the thing is, now we have very good tools available. No point in history of the humankind people have been so capable to do things, and that's amazing. So I'm pretty sure that out there is millions of people already building their own tools, and at some point, these tools need to start adapting and aggregating to pools of tools that will be used in any setup because it's undeniable that AI could help in any specific human field of work. If you are a teacher, if you are a student, if you are a lawyer, if you are a doctor, wherever you are doing, AI can help you. It is also an interesting quote that I just read a couple of days ago is AI should be treated as an expansion of ourselves. What I'm capable to do, AI is going to be an expansion of that. It's going to reach me more, do faster, but at the end, the essential, the human, it never will get lost because it's our essential. Most of people say, oh, okay, you are training models, they will replace you. Never. I think never will be replaced. Elon Musk was saying the doctors will be replaced soon because of surgery. And I don't see that happen soon. At least not in the next 10 to 15 years, to be honest. Technology is, yes, having very, very good advantages every day, but there is an holistic problem and is our own confidence, our own survival instincts that will keep us attached and grounded. What we can really just rely on AI systems or just have like an AI powered system. Just as a big differentiation on which is completely automated or which is just like an assistance. And more in that part, you need to have assistance for an AI grounded to your specific reality that can really help you. At the next point, that brings us naturally to the next point, we maybe have been hearing a lot of agentic AI. Is AI doing basically that? It's like an agent specifically tailored to do a specific task for your own reality. Let's say I want to improve my website. So I take the AI model and I give specific instructions and I give them this specific environment to work with, which is my website. And the AI can go there and check and do a quick, for example, CEO audit. Okay, let me check how I can improve my CEO abilities in this website. Or I can hire UI designer is another agent that will be checking my website. The colors that we're using here, maybe we can check this. So they are more specific tools. In that way, the agents are working more effectively for you. This is really, really interesting.
No, absolutely. Um, so let's say, Javier, you're talking to healthcare professional who's working in a setting. It could be maritime medicine, but it could be a remote hospital somewhere, onshore, or even an industrial setting, somewhere where the resources are limited. And obviously, you don't have all the medications available, but you do have some equipment. How would you recommend for these clinicians to be using AI? And I'm mostly interested in if there's, these situations where there's a bit more of time constraint. Because obviously, if it's a broad question that you're just interested in learning about something and there's no time constraint, then, that's, I think, a kind of a different question. But if there's a bit of time constraint and you would like an answer soon, how would you recommend that these people use LLMs right now?
The short answer is it shouldn't be used at the moment for that specific task. Because yes, you can have some answers, but we are seeing their own challenges. You can try to give a context. You can create projects within these LLMs. You can create projects within Cloud or create projects within OpenAI models with ChatGPT, which is like a folder where you can put the documents, you can put your own things, but they raises a lot of other concerns. So my short answer is none. At this moment of time, you cannot rely completely on that. You can try to better understand what you specifically want. Let's say I'm practicing medicine here in medicine in the shift. So my concern is how to take better decisions regarding some quick, not in the clinical part. Let's say I already know what I have here because I already know. But what I need, for example, is to know how far I'm from shore, what is the best option available. Okay, the helicopter can come, or it's faster to take a boat for this patient who's having a stroke. I have 4 hours. It's already 1 hour in. I'm doing my part. You do your job there. Help me handle the logistics, come back to me. That's where I am exactly working in, attached to a very well structured model where the AI can work in steps and in layers of safety, where every decision or let's say, every query that is responded by the AI is being audited. And at the end, the response that I'm having, it been already have 7 filters. So I have a response which is not hallucinated. It is not assuming anything. It is grounded. It has real data, and at the end I have something that I can rely on. So this is a very specific use case that I'm developing, but for the general people, which obviously is not interested in developing a full structure because it's obviously a big effort, the short answer is it's better for you to understand how the AI can help you in certain specific test or task, and try to get these models to be more agentic for you, like trying to do specific things. For example, help me draft these documents. There is a lot of people creating content with that. This is very good case use. You can create content. You can scrap news. You can scrap some websites. So you can absorb information. It helps you to do your job more quickly. In the clinical side, it's difficult. It's difficult. There are some models. We have some other models or specific tools that are emerging. They are very renowned now and very good names in the field that they are being using for millions of clinicians now. And they are very good because they try to reconcile this academic knowledge through intelligent or smart queries. So you will have like better answers. It's like you have in your, let's say, the latest ATLS guidelines, and you can just talk to them. Okay, I have this. What can I do here? So it's better having like a conversation with the guideline, and you can query and have some decisions based on this guideline. It works when the full guideline can be applied, when the full paperwork can be applied to your reality. So in that matter works. That's why clinicians in hospitals are using it. Is very good for students. It's a really great tool. I assume that you can use this to study, to create cases. So you can go back and forward, like playing with the tool, giving you insights on the guidelines. trying to keep you up to date, that is a perfect case use.
So that's so interesting what you say, Javier. So for the people that aren't working in these big hospitals, do you think that right now there's a way to use these more popular and broader models? Is it to have a follow-up prompt, or do you find that it's more confusing? Because obviously I can imagine many situations where you would ask, hey, how do I treat this condition? And the 5 first treatments that the guidelines recommend, you don't have access to, for example. So that can be even more confusing than helpful, actually. So is that a little bit what brings you to the answer that you just gave us?
Yeah, I mean, if you go through the book was thought to be like that, to answer these questions, because I know that is an authentic question that you have, and that's why I organized the book. The answer is yes. You can always model these tools to your own reality. The problem is the structure behind them at this moment. General tools are not meant. That's why they are general. They are not meant to be specific use. So they can get confused. They will lose context. We have a common term, which is the context rot. So while your conversation takes longer and longer, they will start losing track of what you already say. So that's what these models cannot do. Imagine if you rely on one model conversation where you are doing your own job and you are doing some, I don't know, maybe something, or you have very important information there. And then the model will start losing context of this. And then it's like producing again a very confident response based on hallucinations. Because there's a problem. Models, sometimes they have been trained to say no. They just give you the answer that you might need to hear, and that's it.
Yeah, that's so interesting. And I can definitely feel, you're in a clinical situation, you're giving options, and, you look for these medications, but you don't have them. You don't know initially you don't have these medications. And then, everybody starts running around trying to find a treatment that the LLM recommended that you don't even have where you're working. So I can definitely see where that could actually cause problems. I want to shift gears a little bit, Javier. Tell me, if I ask a question to the LLM and I include in there patient information, name, date of birth, the medications this person is taking, and many other identifiable informations. What's the state of affairs right now regarding the open or the models that we have access to on the web with the patient information?
Okay, you just open the Pandora box, my friend. Because yeah, that's a big problem. That's the biggest problem that the corporate people on healthcare are having right now. And I wrote about this because I make a post in LinkedIn. I say, yes, your clinicians are already using these models at 3 a.m. because they don't have the right tools at the moment. So they are already doing it. We don't know exactly at which point the doctors are trying to avoid sending this personal information, which is really wrong and which is something that is really happening. And that's a problem because these models are not meant to have this kind of confidential information. That brings us to this new conversation about AI scribes. There's a recently boom on AI scribes in the recent weeks where you can just have a software which is hearing everything, and at the end it's going to draft medical notes. So yes, the doctor can save a lot of time doing a lot of medical notes very quickly, very organized manner. But at the end, the concern from the user, from the patient, is what I'm saying here is supposed to be secret. Where is my confidentiality? So that is a really hard to take. Is a challenge now for these scribes, because obviously there is always exists like a organized structure to have IPA compliance. Data has been structured. The server need to be compliant with this. The FDA need to clear this. Yes, they are working in a path to try to keep the data safe. But then the problem is the people are still not confident. You can see the other face of the coin. They are saying, I didn't give consent for this. I did consent for maybe being treated by you to come here, maybe for you to record our conversation in your local machine, but I'm not giving consent to send this to any other server. We have a lot of leakage on information. We have the most terrible thing is to think that our information is being marketed, is being commercialized. And that's the worst thing, because obviously there are big industries and always mean that data means money. because they can target products, they can gauge, they can train, and all of that with data, it's ours. So that creates a lot of new conversation on this matter. So that's why it's not easy to adopt. Is that is there is some multiple fields that need to be addressed.
So, how would you counsel organizations then as maritime companies? But I mean, I like to stick to the kind of more rural, remote, so, these companies that
Mhm.
have sites on a rural site or, private companies. How would you counsel them? Should they tell their healthcare providers not to use LLM? Should they have one that they know already where the data's going and they have already signed consent for the people that they're treating? What would be your opinion on that?
Yeah, they need to create these products for them. Again, even for healthcare providers, the process is very different based on which population are you treating, based with where you are in the world. So my recommendation is you need to do something because your doctors are already doing it for you. They are already taking advantage of these tools. So you need to regulate, you need to open the door for this, and you need to invest, and you need to put very good work on this and try to create a safe structure for your doctors, for your patients, for your data management team, for your IT. So it's an structured decision. Once you get this done, the flow will be easy. But at the moment, even the laws are not really clear. There is a lot of gray area. So that's why it's not easy to adopt, especially when you are taking care of millions of people. You need to be really, really careful. So I understand the corporate side as well. It's something that need to be treated carefully, but at the same time, the technology is evolving every day. So that's the biggest imbalance that we are having at this moment in this reality.
I love that. So I'd love to, with everything that we've talked so far, the context that's different in different settings, and the LLMs might not be adapted, the whole kind of compliance and regulatory aspect. What's your vision, Javier, for the perfect tool for clinicians in settings like the ones like where you work? And I'd love to have your vision maybe for the next year or two. And I'd love to have your vision for the next maybe 5 to 10 years after that, just so I can we can have a little bit of time frame and leeway for technological development.
Yeah, I'm envisioning a product where you can safely rely upon. And as I told you, I think one of the cores that we need to assess here is how to reduce this, let's say, this mental load to the clinicians, especially when they are working in remote environments or where they are taking care of too many people. It's not the same when you are in the floor with another 10 doctors or when you are only one or two for 5,000 people. What if you have 100 patients at the same time? How are you going to treat them? Realistically, it's impossible. So how I envision this model are is in the way that it will help to do some agentic task for you, as I explained before, doing logistics, that you can really trust. That's the most important thing, that you can really rely on based on studies, based on trusted data, that you can say, okay, the decisions or at least the recommendations that this system is giving me are accurate. So I can rely. It's something that I cannot really go deeply through this, and I can focus my energy on treat the patient physically. I need to do a surgery, or I need to do or do any other thing. So yes, I think that in the next year or two, we will need to have a tool. It's not only a tool, it's a structure where the information which is coming, because the models will be changing and changing and changing every day. And every time they understand better, they have more context. These context windows are bigger and bigger. So that means that you can give more information or receive more information at the same time. So the models are being evolving. What we need to evolve to is the structure. What is the safety net? What is the filter? No corporate, no CMO will be deploying a tool in an institutional environment without seeing, okay, what's the safety rates of this product? If you are saying that this model is going to give recommendations to my doctors, okay, show me how this model has been trained, what is the rate of disagreement. So there is a lot of work that it needs to be done. I think personally, I'm working very hard in that. I'm envisioning the product where it reconciles your concerns as doctor, your concerns as patient, and the concerns of the corporates as well. Because of the end, that's the relation that need to work. That's the problem that we're having. If you come with your phone, your own AI scribe is something that your patient didn't know this morning when it was coming to your office, and it's something that for sure your employee also doesn't know. So until we have this structure really well done and shared, we still be having these kind of problems.
That's very interesting. And I love the non-medical aspect part of it too, like to help us with the whole logistics and everything around what we
Yeah,
need to treat patients. Like the example of, taking, like if you have to take a patient somewhere else, the helicopter you talked about earlier, that's really interesting. And now within 5 to 10 years, so you say you still believe doctors will be there. I still believe that too.
sure.
What do you think these tools will help us with, or what do you think it will look like in let's say a 5 to 7 years? Because 10 is pretty far.
Yeah, with this exponential growth of technologies, the thing is there will be more ways to be interactive. So that adds vision, senses, and more omnipresence to the model. So that will help us to have more and more information. And I think that the other technology that is really exploding is wearables. So the more information that we can have from wearables from our patient is going to be great in a model where you can really see what the patient is having at the moment. Your model is abstracting all of this information from your patients. You can see literally in real time what's happening. You can have alarms. This patient is having this without ever even they knowing what's happening. So I can envision a more obviously smart model will have more tools, more senses, more vision to do the things for you. In surgery, I think this is one of the fields where AI will benefit a lot because they are already using robots. Da Vinci robots has been deployed. They are already testing miles and miles away, even in the space, manipulating the robots. So I think there is when the robotics is having a big leap. As you can see, there are different companies now developing this almost in some aspects even more capable than humans, quicker, more flexible, stronger. So in robotics, I can see that for the helping hand for the surgeons, it could be amazing. And if you think in the human part of this, it's amazing because you can deploy a robot in Sierra Leone in Africa, and you can have your doctor in Canada, and they can perform surgeries from there to people who are never probably access to this specific doctor. So that's amazing. That's the miracle of the technology.
Yeah, 100% agree. That's amazing. We talked about your book a couple of times. I'd love if you can just tell us the title, the chapters, what was your expectations going in. I know you're finishing the final chapters soon, so if you could tell us about your book in a couple minutes.
Yeah, sure. Yeah, it's a 10 chapter book. AI Literacy for Clinicians is a book which is meant to have this conversation. Okay, I'm going there because I want to really understand what I'm doing with this model. How can I benefit? What are the risks? In real life because I'm sharing it happened to me. What are the hallucinations? I'm sharing problems that I have, the situations that happen to me. Sometimes they are really hilarious situations where I found so different responses from the model where I'm just saying the same prompt and I have too many different why. So I'm trying to go through from the basics from the first time you open your model and ask a question, how all the process goes, how the response comes to you, how you need to interpret this. So basically, at the moment, I'm in chapter 8. I'm going through all the structure of the models, how you need to have a better understanding of their own limitations, when you need to have more context, when you need to apply more tools to these models, and how to be better at the end, how you can obtain more productivity or obtain a benefit from these models. So I'm teaching how to prompt, how get better results. Yeah. And the last two chapters are reserved finishing in a couple of weeks with some announcements that I have. And I want to share something is really big for me. And it's like building something in real time for the people that I will think the people will love.
That's amazing. I really think we need that. And it's interesting when we were doing more and more ultrasound in emergency medicine. We were going to courses for ultrasound. We had to practice. we had to log cases with an ultrasound expert. And after that, you would get, your certificate that you're ultrasound certified. And then AI tools just pop in and we're just using them without any training, context, courses, or anything. So it's amazing you're doing what you're doing, Javier, because I really think that as a community, we need this, because I can definitely see a way that people would use this, and not only would it not make them better, but it could cause errors in many situations. So I love the work you're doing, and I really think it's something that we need to do as a community to educate ourselves on AI.
Yeah, definitely. Yeah, that's the main goal with that. Just educate if you are doing something, if you have a better understanding of certain field, just to share to the people who can really benefit, especially in medicine, because at the end we are not benefiting. You are not only doing benefit for the doctor, it's for all the patients that they can help in a better way.
Absolutely. Javier, before we finish, I'd love to go into a couple of quick fire questions. I give you a quick answer and you tell me what comes to your mind. Does that make sense?
Sure, go ahead.
Let's do it. Um, we talked about this a little bit, but have you changed your mind on anything in the last 12 months? Um, and I mean, obviously related to AI.
Yeah, yeah, that never trust blindly in AI.
Absolutely. Is there a question that you're never asked, either related to AI or AI adapted to your context, that you feel that people should be asking more often, or you feel that actually that's the question that people should ask you the most?
Yeah, it is. How can I get better on what I'm doing by using the LLMs? Because at the end, you have all the tools, and we are getting almost very easy accessible of tools. But I think at the end, we are overwhelmed. There is a lot of tools, but we don't know exactly what to do with them. So the first thing we need to do is, okay, why am I using this tool for? What is the end game for this? And then we can create a plan. And then how can I get better? It's like you have a tool. I'm giving you this new tool to work with. If you don't have a clue how to use it, it could be the best tool in the world, and you will never get any real benefit of it.
100% agree. Finishing with this, what makes you optimistic for the near future, really regarding everything that we've talked about?
I told you, it's the point in humankind that I'm really glad to be living, which is the amazing possibilities that you have, how you can craft, how you can build your own tools, how can you create your own software, how you can now not be only the spectator because you lack of some skills. Now we are now entering an era which is easier than ever to create. Obviously, there is a lot of content, there is a lot of software, there is a lot of apps that they are being created. And I'm pretty sure that unfortunately, a very good amount of that it will be useless. But from thousands of these apps, startups, programs, softwares, they are one or two or three that can really help people. That's a goal because it's a person behind that before it doesn't have the tools to do it, and now it has. And the most recent for closing is in the hackathon for cloud. They did a hackathon. One of the finalists is a doctor from Sweden, I think. He created in 7 days a tool which follow up with your patients, give all the information to them because his thesis is what happens after your visit ends. So you have a lot of elderly people asking, what is this entresto? What is this? Why I need to take this medicine at this time? We don't really have the time to do that in our current clinical visit. So his vision was to create this piece of tool between you and your patient where they are not in your consultation, when they are not in your office. So that was amazing. He did that in 7 days, competed against 12,000 people who send these startups. And now, obviously, he's having a lot of attention, but also bring my attention and all my respect because it's also a doctor who was practicing actively, working in a hospital, checking patients as I am doing it, and excel in this task, solving a real problem. And that's, I think, the last word is try to solve something. Is not only go behind the money or just try to do something because you can do it now. Try to solve something that is meaningful to you and the people surround you.
I love it. Amazing. Javier, thank you so much for your time. I really appreciated this super interesting subject. Congratulations for your book, and thanks again for coming on the podcast.
No, so thank you so much for having me to open this space. We have a lot of things to talk. There is a lot of things that still need to be done. I'm really sure that we can continue collaborating in the future. Thank you so much.